Well, welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic is arthritis and medical marijuana. I know that for a number of people, including myself, arthritis is something that is a lifestyle condition that, quite frankly, is it's a pain. It's the best way of putting it. It's something that is very disturbing, and medical cannabis can help quite a bit with arthritis, and we're going to talk about that tonight. But the reason that we do a lot of these webinars is my goal is to really help people get their life back. If we can help one person get their life back by watching this webinar tonight, we feel that we'll be successful. And I think that if you can take a look at this as a potential option to help you with relief and pain, this is something that we're really here to provide. And we're here to also answer your questions. So that's what it's all about. A few housekeeping issues. Number one is right over here. You'll see a little Q&A button. It's like actually two Q&A. It's like two little bubbles over here on the right. That's for our questions. We are here to answer your questions, and candidly, there's no stupid questions. You feel free to bring them up. That's what we're here for. We're here to really help you get to the answers that you need, and also to help debunk a lot of the myths about cannabis and get you the facts. The other is that the other thing I want to point out is there is a chat button that's right over here. We don't necessarily we do. You can chat, but we basically look at the Q&A in order to be able to answer a lot of questions. And there are people here to be in the background, Lee and Deja, to help with the chat, and also with the Q&A. But please direct most of it to the Q&A button over here, and please ask questions. We're here for it. Tonight I'm honored to work with a lady I've done a couple of webinars with. We've had some fun in the past. Cassidy Welch, she's with Trulieve, and Cassidy, tell me a little bit about yourself and what you do.
Thank you so much, Mark. I'm really excited to be here tonight. So my name, again, is Cassidy. I work with Trulieve. We are the largest medical marijuana treatment center in the state of Florida. We actually have a footprint in several other states in the country, too. We have over 90 in the state of Florida. So my official role is a community and physician educator. So I work with patients, physicians, clinics who recommend cannabis, and we talk about the products that are going to work best for their patients. And we're going to be sharing some of that information with you tonight, and I am really excited to be here. So thank you so much. Just one quick reminder, if you don't mind, just making sure that your microphone is muted tonight. And as Mark said, just to reiterate, if you do have any questions, we have a Q&A section here, and we will be taking breaks periodically just to answer any questions to make sure that we're all on the same page and together. So thank you.
That works. I do want to point out a couple of things besides. I think what I'm going to do is I'm going to get started with the presentation, and then I want to point out a couple of things that we're doing, if that's okay. I don't want to make this slideware, but I do want to have a presentation so we have some talking points that we can move from, and hopefully it'll trigger some questions and solve some of the issues that are out there. So let me slide over to the presentation. Microsoft here. Okay. And a couple of things I want to point out. This is the Medical Marijuana and Wellness webinar series. We're now into the October 6th. You can see over here in the October 6th arthritis. We take on topics every week, and we talk about medical cannabis, topics that we feel that are of interest to you. A lot of these are brought up by audience like yourself. You'll find on our webpage there's a place you can request these webinars, and we actually take a look at that and do our scheduling each quarter. We also have, next week we'll be doing then pain management. You'll see topicals, anxiety and stress. There's a number of topics that we address, and please feel free to join us for any of those. Now, I also want to point out that tonight's webinar will be live streamed on Facebook. So you'll be able to pick it up on Facebook. And then also, after the webinar, you will receive an email from us. They'll give you links to the video. So we're actually going to take this video and put it on YouTube. So there'll be a link to that YouTube video. It'll give you a link to a copy of the presentation in a flipbook format so you can actually see the presentation. It makes it easier so you don't have to write down a lot of slides, a lot of notes while you're going through this. And then all the references that are here, and then all the discounts. So for example, Cassidy is going to be mentioning discounts, we'll be mentioning discounts. And so you'll be able to pick up all of those and any resources that are out there. So you'll get that probably late Friday afternoon or no later than Monday morning. We try to get it out a couple days after the webinar is put out there, and there's obviously some logistics to do that. But you will get the follow-up. And so let's dive right into arthritis. So one of the things I like to talk about is what is arthritis? Because we hear the term And we also hear about some other underlying conditions that relate to arthritis, like fibromyalgia, for example, and injuries of the joints, arthritis. It's interesting that really arthritis is broken down into two major categories. One is called RA, rheumatoid arthritis, and the other is osteoarthritis. One of them, for example, the osteoarthritis is characterized by being something where you're actually losing a lot of the cartilage in your joints, typically in the hands, feet, and spine. Where rheumatoid arthritis is what they call an autoimmune disease characterized by inflammation, sorry about that, of the joint's interior lining. So it is that inflammation will cause severe pain, will cause permanent joint damage, and will cause disability. So what we see here is that the symptoms that we're seeing is a lot of joint pain. We're seeing a lot of redness. We're seeing a lot of swelling. We're seeing a lot of heat that comes off of that. And so arthritis is something that, especially when you get a severe case of it, your joints just makes it hard for your joints to work and that type of thing. So we're going to address both of these common forms today. I do want to point out that in medical marijuana, there's a couple of things that cannabis can and can't do. One of them, there isn't a cure for arthritis. It's not a matter of medical cannabis or pharma drugs. There's no known arthritis that's out there. It won't reverse arthritis process. In other words, it won't rebuild the cartilage. But more importantly, and I think it's real key, is you can't take a fatal overdose. I know a lot of folks that are taking a lot of arthritis medicines. If you look at the bottles, you'll see that if there's a warning label that it can kill you. Cannabis won't kill you. That's what's the benefit of this natural plant. It's something that's very safe to be able to use. You may get a little high, you may get euphoric, but you're not going to die from it. What can it do? Well, cannabis has been known to relieve a level of pain in arthritis. The reason it does that is because it reduces inflammation. CBD has been known to reduce inflammation, and when you reduce that inflammation, it reduces the pain. And we'll talk about a few cases of that as we go into this. But that's really important to understand, is that by reducing that inflammation, both with RA and OA, it's something that can help reduce the pain from the reduced inflammation, and also it'll improve your overall physical health and help with the anxiety and stress related to it. The people who have obviously arthritis, they're stressed. Of course, today in this environment in general, we're stressed. Okay, so I think the issue really comes down to, what can we have something that can help you? And the answer is yes. So cannabis has a lot of relief that's there, and I know. Cassidy, you've seen a number of people in your clinics and also in your practice where you've seen people with arthritis and you've helped them.
Absolutely. I'm happy that you mentioned that. So prior to my role as a community and physician educator, I was actually working at the Deerfield Beach dispensary as a consultant. And yes, I can attest to this. Specifically, the one case that sticks out in my mind, I was there for about a year consulting, as a regular patient care consultant. And we had a patient who came in, and she could barely move her hands. She had arthritis so bad. And she would actually have to have help opening up her purse and counting out the money. But after seeing her for 4 or 5 months, she started coming in. She was able to open up her bag, unzip her wallet, count out the change. And this is just one case. There are currently about 600,000 cannabis patients in Florida, and I'm sure that they can all attest to this too.
Yeah, it's interesting that when we take a look at arthritis, although they're candidly in the United States, cannabis, marijuana, is a Schedule I drug, meaning it's illegal. It has no medical value at all. We won't go into all the politics of that, but we don't do any research here in the United States. However, we have funded, the United States government has funded research into medical cannabis literally for the last 50 years. That means your tax money, my tax money, have been paying for research into medical cannabis since 1964 with Dr. Raphael Mechoulam in Israel. Since we couldn't do the studies here, National Institute of Health actually commissioned him to do that. And he's still doing a lot of research for us. What's interesting is that in Canada, what they did was they went to the orthopedic surgeons, and they did a study. And what they found out was 1 out of 5 people were already using cannabis to address the pain that they had, or to address their situation with arthritis. Now that's without being prescribed. That was just a random study that they were doing to see if cannabis was in fact being effective. What is interesting is, Dennis Thompson down here in his daily news reported that there were some studies that are done that 9 out of 10 people say that using medical cannabis with their arthritis found that it was effective in managing their pain. And that makes a lot of sense, because if you're reducing the inflammation, it definitely reduces the pain. And I think 9 out of 10 is a tremendous result. 4 out of 10 said it reduced their dependence on other medications. And getting off of medications is obviously helpful for your body. But what's interesting is 6 out of 10 came back and said it is more effective to use cannabis than any other drug on arthritis. So there is some research that's out there. Again, this is a Canadian study, and this is also research that was reported here in the Harvard Medical School, in the Harvard Medical Journal. What's also interesting is the Arthritis Foundation, which goes out and looks into cannabis, reported that 29% of their polled members are using CBD for cannabis. And nearly 80% of them are either using CBD or in the past or is considering using it in the future. So it definitely is prevalent in the Canadian Society for Arthritis, or excuse me, the American Society for Arthritis, for people that are looking for it. And not only does it help with their arthritis, it's also helped with their physical functions, their sleep, their well-being. So it's interesting how we're from a number of different directions, whether it's Canada, whether it's studies in PubMed, whether it's here in the United States with Arthritis Foundation, we're finding a lot of evidence that CBD especially works very effectively on arthritis. So, and I'm going to go here through a couple of studies. I'm not going to run through all of these studies. There's actually 102 articles that we reviewed to get ready for this presentation. But I think all of this is pointing to the same thing, that if you take a look at all the options that people have, cannabis is the best option, both from the standpoint of your health and also for your effectiveness. And I'm not going to go through each of these. They're going to be available in the resources if you want to take a look at them. But I do want to make a very important point here, and that is it has been researched, even though it's not researched here in the United States, and it is very effective. And a lot of people say, well, studies outside the United States aren't as effective. I spent 6 years living in Canada. I spent 15 years living overseas, and of which 11 of those, 11 of them were in Europe. And I can tell you that they do a better job of studying medical research than we do. They are the Germans, the Spanish, the English, the Israelis are very thorough in the way they do it. They do it different than we do, but they are very, very thorough in the way they're out there. So the evidence is solid. And I mentioned earlier, how did we get all these articles in PubMed? PubMed is the journal where all the medical information, all the medical studies are stored for the United States government, is part of the National Institute of Health, put this out there so all medical publications can be out there. I mentioned earlier that we were funding Dr. Raphael Mechoulam since 1964. He was required to put a lot of his studies into PubMed on medical cannabis, which is really fascinating. So that's why there's over 30,000 studies on medical cannabis over the last 5 decades from not only Dr. Mechoulam, but also all of his students and the different folks associated with him. So that's how those studies got out there. And I just get a kick out of the fact that we have these folks that say, especially politicians, we need more evidence. My answer is, did you look at PubMed, our own scientific journals? That's probably one of the most studied plants that are out there. And now I do agree that we need to do more. There's no question we need more studies. But the fact that we've studied it this much and we know the effectiveness is something we should really acknowledge. Let's talk about one case I ran into. Now there's a lot of worms on this slide, so I'm not going to go read this, but when we were doing seminars, we've done I think over 250 seminars now, webinars or seminars. We had a seminar series where we actually did them in person. We did that for almost 3 years. And we were going to go around Florida primarily and give seminars. And one of the places we went to was the villages. And while we were at the villages, and again, these were live seminars or seminars in public, in person. One of the people that helped us was a gentleman named Barrett. He was one of the people that helped us with our media. And his grandmother, she calls her Nana, had arthritis. And Nana was, at that time we met her, she was 88 years old. This was a couple of years ago. She had been suffering for 10 years with RA, to the point where she was embarrassed. She wouldn't go out in public because she couldn't hold a knife or a fork. She couldn't change the remote control on the TV. She couldn't hold things in her hands. And she just was leading a very secluded life. It affected her lifestyle. So we finally got her to come to the seminar, at which she was candidly kind of really blown away. And you'll see in the testimonials here, it was an eye-opening experience for her. And she was used to seeing the Marlboro Man, and she had this perception that all these medical cannabis doctor shops would be like head shops. When she went in, she found out that it was a doctor's clinic. and we got her some medical cannabis that week. We put her on medical cannabis, and literally within 2 months, she was able to go back to a pretty close to the lifestyle that she had. Her hands were open to the point where she could hold a knife, fork, and spoon. She could hold a glass. She could drink water. She was able to change the remote control. Now, this is a lady who is very active, and her husband, they call him Pop Pop, was also very against this. He didn't want anything. He was worried about the dangers of it. And when he came to the webinar and saw what was happening to her, he actually not only encouraged her, he actually got on medical cannabis as well. And I should point out that this lady is now at a point where at 88, 89 years old, she's out playing golf. She's out playing cards with her friends. I mean, she got her life back. Now it's not 100%. She's not back to where she's not what I would call 100% normal, but she'll tell you when you talk to her, she's 70 or 80% back to where she was before she had arthritis. So there's her RA. She had a very severe case. So it's something where I've seen cases like this and many other cases that come up. And I think, Cassidy, you've kind of run into a few of those as well, right?
Yeah, absolutely. And just a little side note, at Trulieve, our average age patient is around 60 years old. So this is just another testament, it's not just people, going in and using cannabis recreationally. We really are using it medicinally here in the state of Florida.
Sure. And the last thing I'll look up on Anna is not only did it help her with her arthritis, she had a pain in her shoulder that actually went away. And even better, she was able to get a good night's sleep for the first time in literally over a decade. So it had other effects. We call those the Entourage Effects. Those are, you treat it for one thing and it helps with other things. We'll explain that. In fact, we'll explain that right now, about how that happens. I don't know. So a lot of folks say, how does this work? Why is it going to help me? What's it do? Well, every person has an endocannabinoid system. This is one of the things that Dr. Mechoulam brought out and actually made public in the 80s and the 90s. It became very popular to understand we had this system. Not that we didn't really know much about it. We hadn't been studied much, but he's the one who actually brought it out. And what we found out is that our bodies have what they call Cb1 and Cb2 receptors. Now, these are receptors that are in our body that you'll notice they're located throughout our body. Now, what do the Cb1 and Cb2 receptors do? They actually are the things that are neurons that actually go in and take a look and help us modulate your pain, help modulate your memory, help you modulate sleep, your immune system, your appetite. This is how your body controls itself. And it was a very major breakthrough to realize this was one of the main mechanisms that your body used to help to heal itself. What they found out was that CBD, CBN, and THC work like a lock and key with those receptors to be able to help them bring basically the body back to health and well-being. More specifically, what's interesting is the Cb1 receptors, which are located in the central nervous system and also located in the brain. These are the light blue ones that you see here, are located throughout your body. And the Cb2 receptors are located in your internal organs, in your immune system. These are triggering mechanisms to help your body manage itself and to help it get better. And what's interesting is that our bodies produce what we call endocannabinoids. You are a cannabis plant, best way of putting it. Your body produces endocannabinoids. Your nervous system will say there's a problem. Those endocannabinoids are produced and it's sent through your blood system to that part of your body to help you with whatever issue that you have, whether that's pain, whether that's inflammation, whether it's indigestion problems or whatever. When you have phytoendocannabinoids over here, which is really plant derived, this is where cannabis comes into play. It works with the endocannabinoids that your body makes. So you can see how it comes in here and it works with the brain receptors that are out here. Now, I will point out that you will hear sometimes about what they call synthetic cannabinoids. These are pharma-based products. Mirinol is one that's very popular that you'll hear that's out there. I'm not a believer that I don't think you can reproduce an apple or an orange in the lab, nor can I think you can produce a banana. I know that a lot of the pharma companies want to produce components of cannabis because it's so powerful. They want to patent it so they can charge you more money for it. But what's interesting is that the pharma-based or the synthetic cannabinoids actually are very dangerous for you. And over here you can see there's a THC only Mirinol. Mirinol is good for a number of different things, but you have to be very, very careful because Mirinol being CHC only can cause a lot of negative side effects. only use it under strict doctor's supervision. It's highly recommended that you take a look at that. So I don't recommend this piece over here. I bring it up because you'll hear about it. If you get into cannabis, please stay away from it unless you have, and yes, you're in doctor's control. But if you have your endocannabinoids, which you have yourself, you work with your plant-based endocannabinoids. Again, they work together to help with sleep, pain, pleasure, sensation, that type of thing. How does that all work? Well, you have the endocannabinoids your body is producing. You may bring into your body some cannabis, and that's interestingly enough stored in your fatty acids. There's a lot of perception that people have that cannabis is stored, goes directly into Cb1 and Cb2 receptors, and in fact, that really is not the case. What is the case is it goes into your fatty acids. Your neurons, meaning the nervous system in your body, will know you have a problem. You don't need a doctor to tell your body you have a problem. Your nerves will tell it. And when it sees that problem, it goes to the fatty acids and breaks them down into long chain fatty acids. And what that does is that they then send those endocannabinoids through your bloodstream to the part of your body that needs the help. So this is something where your body's using your own body, your own mechanism to produce the medicine it needs to produce and help itself. This is important for two reasons. One reason is, why has no one ever died from using medical cannabis? It's because your body's producing its own medicine. It's not a foreign substance. It's not a foreign drug. Cannabis is not a drug. Cannabis is a plant that acts as a medicine, and that medicine works in concert with your body to help your body get into what they call homeostasis, which is your balance, your state of well-being. The other that this explains is something called the entourage effect. Now, what is the entourage effect? People will take cannabis for one reason. My mother took cannabis because she had breast cancer. And so we put her on a cannabis routine. She went to the glaucoma doctor about 3 weeks later, and the doctor looked at her and said, "Your glaucoma's gone. What have you been doing?" And she said, "Well, I'm taking cannabis for my cancer." And then the glaucoma doctor said, "Your glaucoma's gone. In fact, we know it works very well with glaucoma, and go home. We don't need you." So she's had other effects. In fact, it's helped her with sleep and a number of other things. But this is where you take it for one thing, but your body, your neurons know there's an issue, and it produces the endocannabinoids you need to be able to do that. Why do you take it? Because I'm a senior citizen, for example. My body is not producing the endocannabinoids that it was producing when I was 20 or 30 or even 40 years old. So what I'm doing is I'm basically giving my body the natural ingredients it needs, the energy it needs, storing up like the batteries in the fatty acids to be able to help me with my particular medical conditions that are out there. Cassidy, do you have any comments on this?
Sure, I do. I just want to mimic everything that you're saying and give you a little kudos. So yeah, I really want to emphasize that everybody here has an endocannabinoid system. And again, to talk about Dr. Raphael Mechoulam over in Israel, he actually discovered the endocannabinoid system sometime in the 80s or 90s. And not a lot of medical schools have taught this information to their physicians because it's relatively new. But our body does produce this endogenous cannabinoid, hence endocannabinoid system. And that endogenous cannabinoid is actually called anandamide. Anandamide was discovered again by Dr. Raphael Mechoulam. Props to him. And the word anandamide is actually a Sanskrit term for bliss. So it literally translates to the bliss hormone, anandamide does. And this is the natural endogenous cannabinoid that your body is producing. And really and truly, the only other way to, replenish your body's natural endocannabinoid system is to get other cannabinoids from the cannabis plant. And as Marc mentioned, marinol, that synthetic THC, but why use something unnatural when we have something as natural as the cannabis plant that grows from our earth?
And also CBD and THC, when they work together, is like 1 and 1 is 3. There's a lot of positive effects that come from that. So let's talk a little bit about where do we get a lot of the medicines from. And we hear a lot about hemp and we hear a lot about marijuana. Basically, and there's a little graphic that we put together here. They're kind of like, you see the various variations in the dogs. They're the same family. They're just different variations of it. Cassidy, you want to tell us a little bit about hemp versus marijuana?
I would love to. So hemp is actually federally legal and marijuana is not. So it's pretty much up to the state to legalize on a state level if they want, to have medical cannabis in their state. And thankfully, Florida is one of those 33 states, as you can see at the bottom. But the hemp plant, similar to the marijuana plant, they're kind of like cousins, right? Hemp is federally legal. So you may have seen, CBD at the health food store or in your doctor's office or, even dare I say Walmart or the gas station, but it is CBD. It's real CBD. The only the main difference between hemp and marijuana is hemp plants have less than 0.3% THC, so not enough to produce any type of psychoactive effects. So that's why hemp CBD is legal, and different vendors can sell this all over. And to purchase marijuana, medical marijuana, you have to pick it up from the dispensary. So they pretty much look almost identical in appearance. We have photos on slides coming up, but yeah, essentially the main difference is hemp produces a whole bunch of CBD and minimal THC, again, not enough to feel any type of psychoactive effects. And marijuana produces THC, the common cannabinoid that is known to produce euphoria and psychoactivity.
Right. So just to give you some kind of a little background here, hemp, the CBD that's in hemp, there are 82 medical properties for that. The CBD that's found in marijuana has 108 medical properties. So there's a lot more, let's just say, medical properties to cannabis than there is to hemp. The cannabis plant, marijuana plant overall, has 450 medical properties. So you might say, where did the other ones come from? Well, yes, there are some medical properties tied to THC, so you'll get some there. But also, as the THC works with the CBD, it actually produces medical properties together. And you need, in certain cases, you need more than 0.3 THC to be able to do that. I know that, and I'm going to mention it now, a lot of people will tell you that using CBD has helped with their pain relief. And it probably has, but it's done that by reducing the inflammation. It has not provided pain relief to your body. In order to do that, you need a little bit more THC. And that's where medical marijuana comes into place. We can get to a point where we have enough THC and CBD together to help you overcome that pain, that inflammation, without you getting high. That's really the key to medical cannabis. It's out there. So tell me about the main components, CBD and THC. We've talked about it. Cassidy, what are they?
Sure. So again, THC is that euphoric psychoactive cannabinoid that most of us just think about, when you're smoking a joint with, your pals. CBD is non-psychoactive. They both come from the same plant. But CBD is really, really great. Again, you can see here, it's also found in hemp, but CBD is really, really great for pain and inflammation, as is THC, but CBD does not produce those psychoactive effects. And actually, when you're using them together, the higher the dose of your CBD, the less psychoactive you're going to feel, because CBD kind of balances out those psychoactive effects of THC. So if you're uncomfortable with, those psychoactive euphoric effects, I would just recommend maybe upping your dose of CBD, taking a little bit more CBD, a high CBD product. And we're going to go into some of those ratio products, we call them, products with both CBD and THC.
Yeah, a lot of people don't realize that as you're starting your journey into cannabis, one of the issues is I don't want to necessarily get high, or I'm worried about the euphoric effect. How do I counterbalance that? I recommend people keep some CBD around. Now, I believe in what they call the full spectrum CBD, which has just a little bit, that 0.03 amount of THC in it. Some people prefer broad spectrum, which has zero, close to zero. It can't be zero, but pretty close to zero. But if you're taking a product that has some THC and you're starting to get high and you don't want to get high, just take an equal amount or a little bit more of the CBD, and literally you'll come right back down to where you were before. It's a very effective mechanism for being able to manage that. It's there. So we talked about the CBD wheel. We were talking about the medical properties. And on one way, I'm going to apologize for this because it's the latest THC, the latest CBD wheel that's out there, but it's a couple of years old, so it doesn't have all the medical components on there. So we'll talk about those in just a minute. But why don't you take us through a little bit of the CBD, CB products and TH products that are here?
Sure, yeah. So currently there are about 300 known cannabinoids, but again, there are not enough studies being done to actually know how many there are. But these are some of the commonly studied and commonly known cannabinoids that you'll find. So CBD, you see here, it's really, really great for arthritis, inflammation. It reduces the risk of artery blockages. It relieves pain, anxiety. And then if you kind of look up towards let's say top right, delta 9 THC. That's the THC. We don't say delta 9 THC when we're talking about THC. We just say THC or cannabis, marijuana. But this really is the pain relieving, euphoric type of THC that commonly you're probably smoking in joints or buying in oils from the medical marijuana treatment center. Similar to that, if you look to the right, we have delta 8 THC. So this is like the sister of delta 8 or delta 9 THC. Delta 8 has all of the same amazing qualities that THC does. It's again great for pain, inflammation, insomnia, all sorts of ailments. However, it's less likely to produce any type of anxiety, and it's a little bit less psychoactive than the delta 9 is. So if you are looking to use THC, but you're really trying to stay away from those psychoactive effects, then I would definitely say try a product with delta 8 THC. And similarly to, hemp CBD that we can find, all over the place, health food stores, again, for instance, you can find the delta 8 THC, but the problem with that is most of those products are not lab tested. And when you're going to a medical marijuana treatment center, all of the products, they are required by the state to be tested by a third-party lab. So you can actually look up the batch of our products and it'll tell you the percentages of all of these cannabinoids, even the minor ones, the CBG over here, that's a great sleep aid, the CBN that's not on this wheel, but again, really, really great for muscle spasms and insomnia. So these are just some of those cannabinoids.
Yeah, and we should point out, there's a huge craze. In fact, we're going to do a whole webinar on Delta 8 in a couple of weeks. But Delta 8 really needs to work with CBD or THC to be effective. By itself, it really isn't very effective. I know I've talked to people who said, well, I bought some Delta 8 at the local head shop and it's not doing much. Well, that's because it's not tied to the right CBD. I mean, Trulieve makes a great CBD Delta 8 product, which is great. And I highly recommend it, but it's a quality CBD and that triggers it. A little bit of THC with your Delta 8 will also help, especially with pain relief. Don't be afraid of THC, the Delta 9. In fact, if anything, use it because it's going to help you with the pain. And we'll talk about some ways of using it without necessarily getting high in a minute, but it's something that we need to pay attention to. These all work together. And I mentioned earlier, 1 and 1 is 3. You can see the pain relieving of Delta 9 over here. You can also look over here and you can see CBGA, all the pain relief that's going on over here. So you can see also over here, you'll see a lot of this, the THCA, which helps with a lot of that. So these all work in concert together. This is called the whole plant. I know there's a question about RSO and we'll get to that in a minute, but the whole idea is the whole plant works together in concert to provide all of the components that are out there. And there's a huge trend, especially in the pharma industry, to isolate one and talk about that. But I can tell you that Delta 8 by itself, that you buy from a head shop or any place else, is not going to be as good and not going to be as effective as when you get it into a cannabis product that also has a little bit of THC or a little bit of CBD that's out there. And so it's important to point that out, that don't get caught up in the marketing hype. Get caught up in what's important to really help you get there. And then also there's a little something, we're going to introduce a concept called terpenes. And terpenes are an important part of cannabis because the terpenes, much like essential oils, are part of cannabis. It's that part of cannabis that helps protect the plant from animals eating it or from bugs and infection, mold, fungus, that type of thing. So the terpenes actually are coming. We'll talk a little bit about what they do. But it's interesting because the terpenes working with cannabis actually help you fine tune the strains and the plants that you're using to help you with your particular condition. We'll talk a little bit more about that, but I want to introduce that concept right now, and we're going to embellish that just a little bit as we go along. Because the wheel is a little bit deficient, here's a few. Cassidy, take me through a few of them, like for example, CBN and CBG.
Absolutely. So these are some of the main cannabinoids that you're going to see when shopping with a medical marijuana treatment center. So again, we've kind of touched on THC. It's really, really great for it's a sleep aid. It helps with nausea, insomnia, muscle spasticity. It also enhances your mood. CBD, again, non-psychoactive, works well to treat inflammation, reduce seizures, reduce anxiety. It really, really, really is a great anti-anxiety medication. And again, that CBN that we're starting to see more and more studies come out on, the CBN is not psychoactive on its own, but the CBN is a wonderful cannabinoid because it actually acts as a potentiator for other cannabinoids. And potentiator, the base word there is potent, so it actually increases the effects of other cannabinoids when you're taking them in conjunction with CBN. So CBN stands for cannabinol. It's a wonderful anti-inflammatory, just like CBD. It's a wonderful antibacterial, and it also is working great for helping patients fall asleep and stay asleep as well. So again, the CBN alone is not psychoactive, but it is a potentiator for other cannabinoids. So if you use it with, let's just say, our psychoactive friend, THC, it's going to increase those psychoactive effects.
Sure, sure. And it's something that I think it's important. Again, all these cannabinoids that are being discovered to come out, they work in concert together. We're going to talk about individually what they're contributing, but as you put them together, again, that 1 and 1 is 3. Sometimes 1 and 1 is 1 and 1 is 5. So it's important that we put them all together, and we're kind of introducing you to a little bit of the family. Let's put it that's out there. But there are, like you mentioned, there are. I think the number of cannabinoids. They really don't know how many are in cannabis because they're discovering more of them every day. But there's at least a couple hundred that they've been able to identify so far. When I got in the business, I got in the medical cannabis business. This was about 9 years ago. All I heard about was sativa and indica. Everything was sativa and indica. And so I find it interesting. So Cassidy, I want you to explain a little bit about that. And in the last 9 years, we've come a long way. We've developed a lot of different cannabinoids, which, by the way, target conditions like sleep, like cancer, like arthritis, like pain, like inflammation. And so there's a lot of strains and terpenes that are targeted for that. We'll talk about what can help you with arthritis in a few slides. But tell me about the indica and sativa, and let's migrate that into the hybrid world.
Sure. So the sativas generally have the rep to grow a little bit taller in stature. Their leaves are a little bit skinnier if you refer to the photo on the left. They also take a little bit longer to flower and grow. And originally they came from Central and South America. So when I say original, I'm talking about, thousands of years ago, because cannabis has been used medicinally for thousands of years. I
think actually the first medical reference of using it was over 5,500 years ago in China.
Yes, exactly.
Yeah.
It's also mentioned in a couple of different religious documents too, so it's cited there. But yeah, similarly, sorry, I lost my train of thought for a second. But indica plants, however, if you look at the leaves, they're a little bit thicker. They're a little bit shorter, broader. They're better suited for colder climates. So originally they came from Central and Southern Asia. You may have heard the strain like Hindu Kush, or you may have heard someone talking about Kush. Indicas were actually thought to originate in the Hindu Kush mountains. So, they've both been around for thousands and thousands of years. People started migrating around, taking their plants with them, and they were crossbreeding them. So essentially what they came up with was hybrid plants. So now we have this new generation.
Before you jump into that, sativa has been potentially known to be more energizing. Sativa is, and indica is more relaxing. Jokingly, they call it in the couch. And I say that because when you hear of sativa leaning or indica leaning hybrids today, because if they're either leaning towards getting you more energetic or they're leaning you towards relaxing. And that's where you'll see it coming into play today. Because the cannabinoids, we've developed a lot of knowledge over the last 10 years. And we've discovered a lot about strains and what they do. And when you take a look at mixing the sativa and the indica together, you get a hybrid, right?
Sure.
And that hybrid is something that they put together to be able to address medical conditions, again, like arthritis, like pain, like inflammation, and intestinal issues. So they're actually getting down. It's becoming very much a science. about what's out there. And then also they're taking a look at the terpenes that are involved in that, what terpenes come along with those particular strains, and it helps be able to target what you have that's out there. I know that when I first got in the business of cannabis, I was working on it and studying and doing a number of things. But then I really got my renaissance about 5 years ago when I was in an automobile accident and I was rear-ended, and I ended up with 7 herniated discs in my neck and 2 in my back. If you ever want to have your bad day, it's when your doctor comes in and says, "You're my PB. I've never had a personal best of this many herniated discs in the neck, and there's nothing we can do to operate." And so I got into medical cannabis because the pain was just ridiculous. It was on a scale from 0 to 10. It was a 7 or an 8 when I woke up every morning, and I couldn't go through my day like that. Now they were giving me a lot of drugs, of which I used the drugs for about 2 days, and then I said to my wife, "This doesn't work. I can't literally sit on the couch." I was numbed up. Went to my medical cannabis clinic, got some cannabis, and literally 2 weeks later, got my life back. My pain level is now below a 1 on a daily basis. I can run my life. Now I have a regime that we'll talk about. How did I find it and how did I get there? I have a regime that I follow, but it's something that's really important to me because without it, I couldn't get my life back and couldn't do webinars like this or be able to do the research that I do. And that has to do with a lot of the dosing, about your own biology. You want to talk a little bit about that, Cassidy, or you want me to take it?
Yeah, sure. Let's go into dosing.
Yeah, because I think everybody's, when people say, "What should I take?" I know there's some questions in here of what should I take for? Cannabis is not like take 2 pills and call me in the morning. It's not the pharma approach to there. Cannabis works with your body. As we showed you earlier, your nerves, nervous system, neurons, see what's there. It produces the medicine that you need and sends it to your body. And every person's body is different. Every metabolism is different. Let me give you an example. We all know about alcohol. And a lot of people have friends. I have friends who have 1 drink and they're done for the night, literally. And you have other friends. I have other friends that can drink the whole bottle and they're just getting going. And that has to do with their metabolism. You know, some people like light colored drinks, you know, gins and vodkas. Some people like dark colored drinks, scotches and bourbons. Some people like an umbrella in it. I mean, it's that kind of a deal. But it really has to do with your metabolism and what works for you. And that's what's important about cannabis is you got to figure out what works for you. What is your tolerance to THC? How much THC can you tolerate? And once you understand that, we can then start adjusting the CBD side to be able to really dial in what we can do to help you with your particular condition. And that's where the ratios come together. You'll hear about 8 to 1s or 1 to 8s. What does that mean? The first number refers to how much CBD is in it. So if it's an 8 to 1, that means there's 8 components, the 8 CBD units to 1 THC unit. And so typically what we do is we recommend that you talk about what should we start with. Start with a 1-to-1 ratio. Start with 5 milliliters, which is the first little line that's on the dropper, on the eyedropper. Do that for 2 or 3 days and see what happens. If nothing is happening, then up that to 10. Okay. And if that doesn't work, then after a couple of days, and not a day, but after a couple of days, then maybe up that to 15. At some point, when you get like 15 and 20, you'll begin to feel a little bit of the THC. You'll be able to feel that effect. And then what you do is you just want to back down a little bit. And that's your ratio of THC. That's your THC tolerance. And then we can up the CBD levels and the other components that are there to really help dial in what's good for you. And that's pretty much what we're talking about. And we'll talk more about this as we go along. But let's talk about one of the most important things that's out there. We know that you're developing a lot of strains for different conditions. What about these old terpenes? By the way, there's over 200 different terpenes in cannabis, but these are like the top 6. So tell me a little bit about these terpenes that come along with our cannabis.
There are lots of different terpenes, and you can access all of this information on our lab reports, as well as all of the cannabinoids you're interested in seeing that information. But the terpenes, so again, they're the essential oils that are found in all cannabis plants and most botanical plants in nature. So they're the aromas and the flavors. For instance, if you look to the left, we have limonene here. Limonene sounds a lot like lemon and citrus, right? So generally, limonene is uplifting, energizing. It's got that, really, really clean, citrusy smell, and typically it does elevate mood. So patients, with something like depression may benefit from using limonene. And your nose really is your first line of defense when it comes to getting to know what your body needs regarding terpenes. You know, you open up that jar of cannabis and you may say, oh, wow, it actually smells a lot like pine needles. Well, what you're smelling is actually pinene, right? It's found in, you know, conifer trees, lots of herbs in nature. It's again a wonderful anti-anxiety, and here you see anti-inflammatory. So you're going to find pinene, limonene in a lot of strains at Trulieve. Again, there's lenolol here. Well, you can see the photo of lavender, so it does have a nice relaxing aroma. If you think of like a lavender essential oil that you may put in your diffuser, a lavender baby lotion, something like that, it works the same. Cannabis plants actually do secrete a lavender essential oil, a lenolol, and it's wonderful for inflammation. It works as a sedative, again, antidepressant. So
And it's great for pain relief.
Exactly. Yep. All of these terpenes and all of these terpenes actually do contribute to what Marc was mentioning earlier, the entourage effect, the way the cannabinoids, the different cannabinoids and the different terpenes work together in your body. And it really, really is a case by case basis. You know, I may not like the aroma of pinene. So that translates to when I'm using a product that's high in pinene, well, it may not work for me. That's not what my body needs, right?
One of the things that's important about pinene, there's a pro and a con to pinene. Pinene is really great for pain relief, anti-inflammatory, those types of things. However, and it also brings back memory. So if you're having memory loss problems, it's great for that. However, if you're suffering from PTS, if that's an issue, you want to stay away from pinene, because pinene can bring back memories, which is what you don't want to have happen when you're dealing with PTS. And you can ask the bud tender, the person behind the counter, if you know what's in the product, and they will show you. They actually have tables. I was shocked, by the way, if you're going to one of these CBD shops or whatever, ask them for what's in the bottle. Ask them what they call a COA. Okay, what's the content with the analysis that's there. They will normally not be able to tell you what's in the bottle that you're buying. They'll tell you what's in the batch. They'll tell you what was tested for the whole batch over the whole year, but they won't be able to tell you what's in that particular bottle. And that's really, really important, because this is a medicine and you want to know what you're putting in your body. Every dispensary here in the state of Florida, especially Trulieve, will tell you exactly what you're getting when you buy that particular product. And please feel free to ask them. I was shocked. I just got back from California. I was there for the last 10 days. And I went to 3 different dispensaries, and they actually could not tell me what the terpenes were in their products. And I was just shocked. I mean, I could not believe, now, I believe it is a state law for them to know, okay? God bless them. But it just, to me, was just really shocking that here I was trying to figure out what to get, for example, for my mother and for my brother-in-law, and I had just trouble finding the right products. In fact, I found one product that I ended up looking at that actually had mold in it, which means it wasn't tested. And that was shocking to me. That does not happen here in the state of Florida. I say, you may criticize Florida for a lot of things, but they got it right when it comes to putting these dispensaries together and what they're doing. And by the way, it's not cheaper. A lot of people said it's cheaper in California than it is here in Florida. And that's not true. I found the cannabis to be about 20% higher, just to give you an idea. Of course, California in general is higher, so that might have something to do with it, but I'm just saying. So tell me about Miracin, if we can. Miracin is followed almost everything.
Exactly. And if you see the photo of the mango there, it's actually one of my favorite terpenes, and it is the most common terpene found in the cannabis plant. So Miracin, with that mango fruity aroma, you're going to find it in mangoes, obviously lemongrass and basil. Again, a wonderful pain reliever. It's also, you may find it in a lot of those indica strains. Again, indica, couch, Marc mentioned, they're generally more sedative when it comes to body effects. So Miracin is commonly found in a lot of indicas, and it may produce kind of like a sleepier effects.
Sure. Now, people may wonder, why do we pick these 6? We went out and I did a study of the best strains for arthritis, and these are the best 6. Okay, so if you're asking for any one of these, we'll help you with arthritis. Caryophyllene is really interesting too, because that's something that not only helps you with a lot of the anti-anxiety, antidepressant, pain relief, but also it helps in many cases reduce alcohol cravings, which is very fascinating. And one of the ones I really like is Eucalyptol. And the reason I like it is because as a senior citizen, we all worry about our blood pressure, and Eucalyptol helps with the blood pressure. And that's something that's really, really important. And again, it has, like eucalyptus, it has a scent and a flavor to it that's really, really important. You can, if you smell, especially in the flower, you can actually really smell this. And I know Chris Cano, who's the head of Normal here in Central Florida, and I have discussions about what's the best smelling cannabis that we've had, because you actually, it's much like going to a flower shop. You can actually have great scents and flavors that are out there that can really help you. And it goes back to what you said, Cassidy. Listen to your body. It'll tell you what works, what you like, and what you don't like. Let's talk a little bit about strains. I'm going to stop for a second, though, and just say we're getting good questions. And I want to thank everybody for the questions, but please feel free to hit that little button and ask your questions. We're here to answer your questions. We're here to be able to help. So again, there's not a bad question. There's plenty of good questions. So please help bring it on. We're here for you. But these are kind of the recommended strains for cannabis. You want to go through those, Cassidy, or you want me to take them?
Sure, yeah. So most of these strains here, if you look to where it says THC and CBD, most of these are high CBD strains. So when we're talking about the Entourage Effect and ratio products, and I believe someone in the chat may have asked, well, where do I begin? What's the best product? Which product should I start off with? Maybe one of these strains, the high CBD strains. And again, you can see the terpene profile here, the myrcene, one of those common terpenes that you're going to see in a lot of those indica strains, right? So when we're talking about the THC and the CBD combination and the dominant terpenes, again, we're talking about that wonderful entourage effect that works differently in everybody's body.
Yeah, and what's interesting is, now, and I want to point out, it says dominant terpene, so we put one of them in there, but you'll probably have a certain amount of, for example, if you take a look at ACDC, I know it does have caryophyllene in it, right? And I know it does have other strains, other terpenes that are in there. But these are the, so what do you do with strains? When you go to a dispensary, these are probably going to be the strains that they'll recommend for you. When I first started taking medical cannabis, I went into a dispensary. The doctor had looked at me, produced a recommendation. The dispensary actually looked at the recommendation, and they talked to me for a little bit, and I told them what I had, and they said, well, here's the product we recommend you use. And I remember saying, okay, fine. And I went home and tried them, and they worked. And it took me about 2 weeks. I had to get my dosing right and had to make sure I knew how much I could take and my tolerance and that type of thing. But it took me about 2 weeks to dial that in. When I went back, I was getting bolder now. So I asked the question, how do you know you see all the products behind me, out of all these products, how do you know what works for me? And then the person behind the counter said, it's real simple. We're able to take a look at what your medical condition is. We're able to take a look at the obviously what works, what strains and what terpenes work. And then we just nail down our inventory down to those products, then recommend those for you in whatever dosing form that you want, whether you want to take them as vape pens or capsules or whatever that's out there. So there is a lot of science to this. This is very much a science. I jokingly said to my wife, when I grew up in the San Francisco Bay Area, and I said, this is like, you used to go to these Chinese doctors and you'd go in and you'd say, I got this problem. And he'd turn around and he'd go to his jars and pull out all kinds of stuff and bring you something that just smelled terrible. You made it a tea, but it works, every time. It's not, we get the same effect without all the bad smell and that type of thing. And there's not a lot of magic to it, but it is very much a science to what's out there. And that's what you do. I think at Cassidy, at Trulieve, your people behind the counter have been extensively trained on being able to help dial that in for patients. Is that right?
Oh yeah, they are trained for weeks, and they're some of the best patient care consultants that I've ever seen. Honestly, I've shopped around at many dispensaries. At Trulieve, we have over 500 barcodes in the store. So there are a lot of products out there, and that may sound overwhelming to many patients, but when you're paired with that patient care consultant, you do not feel overwhelmed. Again, as Marc is saying, you're going to tell them your conditions. They're going to open up your recommendation from your physician and take all of that into account and show you specifically the products that are going to work best for you. And they're going to ask you what your tolerance is like, what you're trying to treat, when you're trying to use the product, whether that be daytime, nighttime, you're using it because you have no appetite. And I actually think that this is a really good time to answer some of the questions in the chat. So
yeah, go ahead, Cassie, go ahead.
Yeah, there was actually a question that was in the chat, but I had typed an answer, so it disappeared. But I just want to touch on that. The person said, how much does it cost in the state of Florida, and how often do you have to see your physician? So currently there are about 2,500 physicians in the state of Florida. And to find these doctors, just go to trulieve.com. We actually have a find a doctor tab. You can type in your zip code and it'll populate all of the doctors in your area. You're going to just call around. Honestly, it's really variable, and it's up to the physician to decide what they're going to charge. So take that into consideration, call around, and you have to see your physician legally once every 7 months, and your medical marijuana card is good for 1 year. So the physician can certify you for cannabis for up to 7 months, and then there's kind of like a cutoff. You have to get recertified, see your physician again in person, face-to-face, every 7 months. But again, your medical marijuana card will be good for 1 whole year, and then you'll have to renew it. But we can talk about the discounts.
Yeah, the 2 visits a year were, thank you, Rick Scott. He wanted to drive the price of medical cannabis up. No offense. I mean, I have herniated discs in my neck, and if you think they go away after 7 months, you got another thought coming. I'd love to have that happen. Trust me. But he wanted to make it more expensive. And we actually are doing a lot to try to get rid of that second visit, but fortunately, that's the lay of the land. I like to work, for example, with MMTC, Medical Marijuana Treatment Clinics of Florida. And the reason I work with almost all the doctors that are out there. I have a doctor's referral network. I have a number of things. And so I work with a lot of doctors. I prefer MMTC. And the reason I prefer MMTC is 2 primary reasons. One is they have 25 clinics throughout Florida. So they're at least not necessarily in Southern Florida, but in the middle to the upper part in Panhandle, they've got plenty of clinics. The other is that, or they have clinics, I shouldn't say clinic, they have clinics that are fairly close. They have the only doctors that are out there that have what they call a dosing center. So if you get a medical marijuana card from MMTC, there's an 850 number you can call, and they'll help you with your dosing. And dosing is really critical, really key. And that's really the key to making medical marijuana work, because it's very hard sometimes. You try to call your doctor, he's at appointments to get a hold of him, but they have practitioners on the line and have practitioners there that can not only help you get your medical cannabis, but also help you get the right medical cannabis. And if they need to refer to your doctor, they do that, we'll be able to do that. So again, that's another option that you have. And it's one of the reasons why I like working with them. And I wish more doctors had the bandwidth to be able to do that. It's there. You want to try another question?
Yeah, sure. So another person says, are you able to get a medical marijuana card with scoliosis and plexus issue? The answer is yes, you absolutely can. There are 10 top qualifying conditions. However, you can have a condition that's similar, something like chronic pain, scoliosis, and yes, absolutely, you will be able to get your medical marijuana card with that. One
of the things that Florida did right was there are literally 300 to 400 conditions that help you qualify for medical cannabis. So rather than trying to list for the doctors all of those conditions, which makes it very difficult for paperwork nightmare, what they did was they came up with a list of conditions, and then they said leave it up to the doctor. They said it to the doctor, if you see someone who has a similar condition to this, they qualify for medical cannabis. So for example, I have herniated discs in my back, and herniated discs are not part of the 13 qualifying conditions, but MS is, and it's very similar to MS as to what it works. It works with the brain, the inflammation, that type of thing. So I actually qualify for that. So they did the right thing. They left it up to the doctor to make the decision. They left it up to the guys who know the science to be able to follow that. And so if you don't see it on the list, don't think you don't qualify. By the way, if you go to a medical cannabis doctor and you don't qualify, normally almost all the doctors I know don't charge for that visit. Unless you qualify, you don't get charged. So no harm, no foul to give it a shot and to see what's there.
Sure, and be honest with your doctor. You know, you may have scoliosis and arthritis, but you may also have insomnia, PTSD, some other things going on. Just tell them everything, every ailment that you possibly have, and again, be honest, and they will certify you for your medical marijuana card. Because as Marc is saying, there's hundreds of conditions that could qualify you.
Right. One of the anonymous questions she said you went to the Trulieve website and couldn't find a place with a doctor. Lee or Deja, can you actually find that? And can you actually find that and put that in the chat, if you don't mind?
Yeah. We'll put the link in the chat for that.
Yeah, we'll give you a link for that in the chat, which could help you quite a bit for that. One of the great questions is vape pens safe to use?
So that is a good question. And Mary, the question actually came from Mary. So you may be familiar with the newspaper articles and the magazine, the web headlines that were coming out a couple of years ago, 2 or 3 years ago, I would say, where people were ending up in the hospital because their lungs were exploding. Ultimately, that is not due to cannabis. That's not due to CBD. That's actually due to the vitamin E oil that they were using as a cutting agent in these products to make it feel a little bit easier on the lungs. But essentially, we see what happened there. So prior to this, the thing that was going on with the exploding lungs, Trulieve, actually, we had vape carts, not with the vitamin E oil, but we had mixed some of them with MCT coconut oil. But we just went away with all of the cutting agents, and all of our products are pure cannabis oil. And yes, they are generally safe to use.
And I think most of the dispensaries here in Florida have done the same thing. They've got rid of all the cutting agents. I know there was a question about, what cutting agents are really safe. The answer is by getting rid of them, you've been doing with pure cannabis oil is probably the safest way to go. I don't, there's a lot of opinions on a lot of them. What happened was there was a bad actor coming from Asia that was using a cheap cutting agent. They produced cheap pens in quantity that they sold in head shops. And that's where the problem was. And they weren't tested, and there weren't rules and regulations to make sure that they were tested. And that became a problem. Florida, every product is tested. I know any product you buy from Trulieve has been tested at least 3 times, which I think is really important. Twice by Trulieve and 1 by an independent lab. And if you want to find out information about it, ask for what they call the certificate analysis, COA. There's a QR code you can click on. It'll tell you exactly what's in that particular product that's out there. And high quality cannabis products in any state or whatever out there, you should be able to have the QR code on the side of it, and it'll tell you the components that are in there that are there. Vape pens are safe. What was unsafe was the fact it was an unregulated bad actor that actually was taken out. Was taken out. We haven't had any problems since, and especially if you stay with the state of Florida certified dispensaries, you'll have a problem. If you have a question and you go to a CBD shop, ask them for the COA. And if you don't have a COA, buyer beware. That's all I'm saying. That's really the question that's out there. Be careful of what's out there. There's a lot of junk that's there. I'm going to take one more question, and then I'm going to let's run through the rest of them and answer the rest of the questions. One of the questions is RSO better for pain than others? You want to take that, Cassidy, or should I grab that one?
Yeah, sure. I'll take that one. So we're not going to go into RSO in this PowerPoint presentation, but for anyone curious, RSO stands for Rick Simpson Oil. And Rick Simpson is actually the guy who started making this oil. Unfortunately, he doesn't get anything for, anyone labeling their products as Rick Simpson Oil. I guess just, kudos to him for creating this super medicinal product. RSO is a full spectrum product. It's very, very strong. So it's wonderful for pain, but this is not the product for a novice patient, a beginner, someone who's never used cannabis before. This really, really is for a patient who is seasoned with using cannabis because it is so strong. So in the RSO, again, to make it full spectrum, you're going to find all sorts of minor cannabinoids. You're going to find CBD, CBN, THCV. Martha, you had a question about anything helping with weight loss. THCV is actually that cannabinoid that's an appetite suppressant. So you can find all of those cannabinoids on the RSO and the whatever products they're on the COA lab reports, which we are very transparent with. You can find all of this information on our websites. But RSO is a very strong product. It's a wonderful product. But again, it's all about dosing. Start very, very low, go slow. This was a product that was originally created to help cancer patients with all of the pain and the nausea and the growth of their cancer cells too. Rick Simpson oil has actually been proven to slow down the growth of those cancer cells. So again, anyone curious about Rick Simpson oil, you can find a link to that on our website, or maybe we can just throw the link in the chat.
I think more importantly, Trulieve, you have a patient can call up and you can get a consultation, and it's free. So exactly. You can set up a consultation. They'll walk you through it. They'll walk you through RSO. I tend to explain to people that RSO is like 151 Bacardi. Okay, it is great. It is a great rum, but it is strong. And it is strong for a reason. It was developed by Rick Simpson to basically combat cancer, and it does. Okay. And it has, and there's, by the way, there are labs. How do you know that? Because 23 years ago, Dr. Cristina Sanchez was given a lab in Spain to study cancer and medical cannabis 23 years ago. And we haven't been accessing her research, but she's done some great studies, and in PubMed, you'll find a lot of them. So what I'm trying to point out is RSO is designed, it's like 151. I don't recommend you just, if you have someone who knows cannabis or you have a doctor that can walk you through it, but it's for pain, for cancer. It's a whole plant relief. It is fantastic. It really does. I know that there are times where I kind of got into overdoing it. I got into a martial art, and there are times I kind of overdo it, and I turn to RSO to let my body basically recuperate. So yeah, it's something that's out there. Let's talk a little bit. I'm gonna skip this next slide and go right into the dosing forms. So the question then becomes, how do you take it? I know that there's a perception that everybody sits on the front porch smoking a joint. That's not really true. We've come a long way since those days. Why don't you explain some of the ways that people can take cannabis and their options?
Sure. Well, the smoking the joint on the front porch thing, it is true and it's not true. I would have to say more people than you think. Your next door neighbor may be a cannabis patient and you may not even know about it. Because we did say that there are 600,000 cannabis patients in Florida, but that is not accounting for the closet users. So you're right. People do smoke joints. We do have the smokable flower available at the dispensaries, but that's not the only product that we have. We have sublingual drops, tinctures. These are under the tongue oils that start to break down in your mouth. So these, you're probably going to feel the effects for around 4 to 6 hours, and they may take about 20 minutes to feel the effects. It's actually first started to break. It starts to break down in your mouth before it breaks down in your digestive system. There are also, vape pens that we talked about.
By the way, when you do sublinguals, they go directly into your bloodstream. So it bypasses your stomach. It goes directly into your bloodstream. In my case, it takes about 20 to 25 minutes to work, and they typically work, again, between 5 to 6 hours. And again, you'll notice that your body will tell you when it's working, when it's not working, how long it takes. But it's very effective. In fact, it's probably the most popular way of taking medical cannabis today.
Exactly. It's easy to use. Most of the time, one drop is going to offer you 1 milligram of whether it be CBD, THC. But yeah, you're going to feel the effects for 4 to 6 hours, depending on your body chemistry. And they're first broken down in your mouth. So you're going to feel them relatively quickly, in about 15 to 40 minutes, again, depending on your system. So there are also vape pens. They're a little bit more discreet than the smokable flower, which, smells a lot and you have to, light it or whatever. Vape pens are pretty discreet. You're going to feel the effects almost immediately, and it's going to last for about 2 to 4 hours. So I guess really the benefit here is instant relief. You have pain now, or you're having a panic attack or anxiety, something like that. You can grab that vape pen and, take a couple of sublingual drops and vape in the meantime while you're waiting for the effects of the oral product to kick in. There are also capsules, which are.
I'm gonna chime in on that. I mean, look, when I wake up in the morning, because of my herniated disc in my neck, and I have a whole regime that I've worked out. But if I wake up, sometimes I'll have a level of pain of a 7 or an 8 that's there, and I just don't want to run that through the day. On my nightstand are sublingual drops, and I take my sublingual drops. And right next to that sublingual drop is a vape pen. And what do I do with the vape pen? I take a hit right after I take the sublingual drops. Now, why do I do that? Because the sublingual drops take 20 to 25 minutes for work. In my case, could take as much as 40 in certain people's cases. But the vape pens work immediately. And I mean immediately. I take a hit, and 30 seconds later, the pain starts going away, and a minute later, it's gone. Now, the first time that happens, especially if you have a level of pain of a 7 or an 8, I said to my wife, this is crazy. This is like, you got to be kidding me. It's like somebody took a rag, wiped my back, and the pain went away. And this was done starting 5 years ago. And even this morning when I did it, I am absolutely amazed at how fast it works and what it does. It puts me into a condition where I'm normal again. I'm not struggling with the pain. I have the movement and things that are out there. So you can mix and match these dosing methods, and that's what's important. Now, pay attention to the fact that for example, the sublingual drops last 4 to 6 hours. So if I take it in the morning, early afternoon, they're wearing off. So I've got to do something in the afternoon because my pain in my neck is not going to go away. Okay, it'll come back. And then early evening, so I have 3 times a day because I have a severe condition. So I'm taking it 3 times a day to be able to manage my situation. And I take, for example, a lot of one-on-ones in the middle of the day. At the end of the night, I'm getting a higher level of CBD. And actually, before I go to bed, I usually try edibles. And the reason for edibles, and we'll get into edibles in a minute, I'll let you take that one, Cassidy, is because they'll last 6 to 8 hours. So I'm not waking up in the middle of the night. It lasts for the whole night. But why don't you explain going to capsules and edibles?
Exactly. And like Marc was just saying, it's all about finding the right regimen for you. You know, you're going to go see a doctor and they're going to consult you and tell you what they think may work for you or could work for you. But again, it's a recommendation. It's not a prescription. They're not prescribing you 1 vape pen and 1 capsule per day. It's really up for you to decide which products are going to work best. And the only real way to figure this out is trial and error. So at Trulieve, we offer a super lenient return and exchange policy. I mean, if you're a brand new patient and we have over 500 barcodes in the store, you may want to get 1 product per route of administration. You know, you may want to leave with a vape and a capsule and a tincture. Try them all out. And if they don't work for you, you can take them back to Trulieve. And we are the only medical marijuana treatment center in Florida who stands behind this super lenient return and exchange policy.
I have to give you full compliments for that. I know that there's certain cases where I bought a product, I went to try it, it didn't work. I've been out $50 to $90, and it's just not working. And I was able to take it back and exchange it. You're the only dispensary that allows you to do that, and I think that's wonderful because. And by the way, it doesn't make any difference how much you work, how much you take. If you take half the bottle, you'll still take it back. You want to be able to do right by the patients, and Trulieve has really done a good job of being able to do that. So that I compliment you on that. Thank you very much.
Thank you so much. Honestly, we're really patient forward and patient centered, and we know that there's a product out there that's going to work for you. You may not find it your first trip to the dispensary, but as Marc said, we offer private consultations. You guys can kind of see how Marc's in the dispensary right now. That's the dispensary setup back there. You're going to be paired. There's about 12 registers or point of sale systems in each dispensary, and you can ask for a private consultation if you prefer, if you're more comfortable, or you can actually book a free virtual consultation online too, which is another great thing that we offer.
A telemedicine type of thing. You can get it online, which is great. I think it really helps quite a bit. Something to take a look at. The capsules actually, going back into that, the capsules actually work by going into your stomach. And so it takes a little bit longer to work. I think really practically capsules take about an hour to work at least in many cases.
Agreed, depending on what you've eaten, what's in your body chemistry again, but the capsules are really interesting because, you know, they could take up to 2 hours. You're going to feel the effects for most of the day. So if you have pain all day and, you know, you need something to combat that pain for 8 hours, let's say, maybe a capsule could work for you. Again, they're interesting because they're broken down in the liver. When you're taking anything, when you're eating something, and, you know, this goes for edibles, capsules as well. The THC, the Delta 9 THC is actually converted to a different chemical called hydroxy 11 THC. So this is why you're going to feel the effects so differently. You're really going to feel the effects in your body. It's going to be less cerebral and more, you know, relaxing and sedative. So the capsules, 5 to 8 hours, you're going to feel them. Similarly to that with the edibles. Now you're going to feel the effects of the edibles a little bit quicker, you know, similarly to the sublingual drops and the tinctures, just because you're chewing, right? You're breaking that down in your mouth. But we have gummies, cookies, brownies, all sorts of products at Trulieve. We also have topical creams. So this is perfect for patients.
And by the way, on the edibles, be careful because they may take 30 minutes to an hour to work. There's the famous stories of people that are given like a quarter of a brownie to try. And of course, they lose patience and try the whole brownie. And they like 4 times overdosed, or 4 times, you can't overdose in cannabis, but you've taken 4 times the recommended dosage. And so you'll have more of the euphoric effect than with just one piece.
But if we played that a little bit farther and had this patient known that they just could have taken, you know, some CBD or something, maybe wouldn't have felt that way, not that they were overdosing. Again, as Marc said, you cannot overdose on cannabis, but they probably were feeling a little bit overwhelmed, maybe experiencing an increased heart rate, something of that nature. So yeah, just be careful. We're going to talk about journaling in a couple of slides, but just remember, start low and go slow. So all of our edibles are packaged in 100 milligrams per package. That whole chocolate bar is going to look very appetizing to you. The flavor is phenomenal, but just know one piece is 10 milligrams. And if you're a brand new patient, you may not even want to start off with 10 milligrams. You may want to start off with half of a gummy or half of a chocolate square, not half of a chocolate bar, but half of a square.
Yeah. Start low and go slow. It's like, I wish somebody had told me about that when we were in alcohol, go low and go slow, but in cannabis, it's really recommended to do that. Topicals help quite a bit, especially when you put them on, they go right into your system.
Exactly. Yeah. Topicals are great for patients with arthritis, especially, you can identify exactly where the pain is coming from, right? It's your fingers, your wrists, your back, wherever that may be. The topical cream is non-psychoactive, even if it has THC in it. So if you're looking for relief, but you're not interested in ingesting THC or vaping THC, maybe try a THC topical. You can put it exactly where the pain is, and you're going to feel the effects almost instantly and for 1 to 2 hours. So this may be a product that you're reapplying periodically throughout the day.
For arthritis, it's phenomenal. I know most of the people I know suffering from arthritis do use some sort of a topical of some sort. And I know that my mother swears by it, the cannabis, the topicals. Again, it's been 4 years that she's had since she's been diagnosed with cancer. She obviously, in fact, I think she's been 5 years. We just celebrated her 93rd birthday, and she swears by the topicals. It helps her quite a bit.
Yeah, and similarly to topicals, you can also find patches out there. You slap them on, wherever, as close to the pain as you possibly can, your arthritis pain. You're going to feel the effects in 10 minutes to an hour. I know that seems like a pretty long time span, but again, it's really up to your body chemistry. Right. The effectiveness, depending on the type of patch, there are 72-hour patches out there, and there are 8-hour patches. So just be cautious of that, but patches are great for pain and arthritis. There are also sprays, oral sprays. Again, they're broken down first in your mouth. You're going to feel the effects for 2 to 4 hours. This is a wonderful alternative if you're not interested in smoking, vaping, anything like that. So here we have flower. It's one of our most popular products. You may, have seen this rolled in a joint, or maybe you've seen someone smoking it in a glass piece, but we do offer vaporizers. So you're vaporizing the smoke instead of combusting it with a lighter, which is personally my favorite way to use cannabis flower. It's not as harsh on your lungs. You're not getting, you're not burning off the terpenes and burning off those cannabinoids. So if you're interested in flower, might I just suggest purchasing a vaporizer?
And I should mention, I heard a statistic which I don't believe is true, but a lot of people are using flower to cook. In fact, we will probably do next quarter a whole cooking show just on cannabis. Somebody told me as much 30% of the flower sold here in Florida is used for cooking or for making products. I don't know if that's true. I'd say more, maybe 15, 20%. But flower for cooking is absolutely wonderful. It works great. I know that I've used it, and it's very effective. There's a lady in California. She's on YouTube, a senior citizen. She's called Marijuana Nona, and what she does is she makes recipes for senior citizens who need to take medical cannabis, did not necessarily want to smoke or take tincture drops. So she showed them how to put it right into their pasta, into their salads, into their soups, into their things. And she's great. I mean, the lady's over 90. I don't know if she's still alive or not, but I know when I started getting into it, I was really intrigued by her. Cooking is very effective.
There are so many different ways to use cannabis, and they're all effective. I love it. I love that we have all of these different options to choose from. The flower, I might have to, I may believe that statistic, Marc, just because, with our flower prices at Trulieve, you can get 7 grams on Wednesdays for $25, which is unheard of. So if you're interested in cooking, might I suggest that you pick up the ground flower from Trulieve?
Right. And then, of course, you also have concentrates, which are concentrated versions. It's not necessarily for people that are just starting out, But if you do want to be able to use concentrates to be able to really help with pain relief and with inflammation, I know in the evening I use concentrates mainly to help me sleep.
Yep, exactly. And concentrates, they're concentrates of the cannabis flower. So flower, similarly to the RSO that we were speaking about a couple of minutes ago, flower is full spectrum. So you're getting all of those minor cannabinoids and the terpenes and all of that in your flower. Nothing is being extracted. With concentrates, it's a concentrate of the flower. So the flower generally is, you know, around 20, 25% THC, but the concentrates can be up to 90% THC.
Right.
So they can be very, very strong. This may be your product depending on the type of relief that you're looking for.
You got to really know your sweet spot to be able to play with concentrates. But once you do, they're very, very effective. One of the questions that came up, by the way, we were talking about patches. Julia was asking, are the transdermal patches similar to topicals, and in that you get relief but not the high? I know Trulieve, you don't. I know you're coming out with a transdermal patch. You don't have one yet, but I do know it's in the product cards. I think what's stopping you from your doing that is a lot of the supply chain issues that are out there. I do use I use a patch. It's like microdosing. It's just a little bit of cannabis that goes for the 72 hours. And I use it quite a bit, especially when I'm traveling or I'm working or being active. And I just find that 72 hours of the microdosing helps quite a bit. I don't get high from it. You can get THC, you can get one-on-one, or you can get CBD patches. It really depends on what you want to do. And so because of my pain problem that I have, I typically tend to go to THC patches. And then what I do during the day is I complement it with CBD. So I'm able to regulate the CBD and get my pain down, especially my inflammation down and my pain down. One of the keys for herniated discs is to really get into a good, strong CBD regime to be able to get the inflammation down. And after 5 years, I've been able to get it down pretty good. But I think you still need some THC for the pain. You're not going to get around that at all. So I'm able to start with the pain side and regulate the CBD for the inflammation that's out there. It's there. And I hope that answered that question. It's there. We'll take a quick one real quick before we jump into your stuff. Are Trulieve dispensaries in California held with the same guidelines of excellence as Trulieve here in Florida?
So I like that question. Our setup there, the product line is very, very similar. The state of California does have different Department of Health regulations. So you may see some different products there, but yes, our dispensary in California and our dispensary in Massachusetts and our dispensaries in the Midwest, they all will show you the required certificate of analysis. That's that COA that Marc had mentioned before. But yes, we first test all of our products in-house, and then we send them over to a third-party lab, ACS, which is over somewhere in Florida. I believe it's over on the West Coast, but yep, all of the products.
Yeah, the answer is Trulieve the professional dispensaries like Trulieve all have COAs and all do the testing. And by the way, they all do testing with more than just themselves. They also have an outside lab that's out there. So yes, the answer is yes. You may see the packaging be a little bit different, but you'll still have a barcode on the side and still be able to see for that product that you're buying, the actual COA for it. And a lot of times you go into a lot of the CBD shops, they'll have a COA, but it's not the product that you're buying. It has to do with the family of products. So God knows what they could do a family test, and then God knows what they put in the bottle that's out there. And I just think you have to be able to pay attention to that. This sweet spot. We talked about microdosing. We talked about titration. Tell us a little bit about that, Cassidy. How do I know I'm getting it right?
Sure. And this kind of ties into anonymous attendee in the chat who says, what is the typical dose for pain management for osteoarthritis? So that is, it's kind of up to you, and it's up to the patient to take control of their regimen. So regimen, how do we get into
what we mentioned earlier? It's like alcohol. There is no take 2 pills and see me in the morning. There's not a straight answer because your body is going to be different from my body. It's different from Cassidy's body. So the question is, what works for you? And this is where you go back to what we're talking about here is go low and go slow. Start with a 1-to-1. Start taking 5 milliliters. Wait a day or two. Then go to 10. Then go to 15. Find out where your CBD, your THC tolerance is, and then we adjust the CBD for that. I'm going to throw a shameless plug in here. Next week, we're doing a webinar on dosing. So if you're interested, join us for that. We'll dive right into that particular topic. But the answer is you have to find out yourself. You have to listen to your body. And as you're doing the one-to-ones and you're increasing that, your body will tell you what's working and what's not working.
And again, I'm echoing start low and go slow. Start with, as Marc was saying, a one-to-one product, an even balance of THC and CBD. If you find, you're looking for a little bit more psychoactivity, a little bit more pain relief, maybe, next time you shop at the dispensary, pick up something with a higher THC than CBD ratio. Right. But it's all about finding a regimen to work for you, and titrate up. What is titration? So again, every couple of weeks, the dose is raised until the maximum effective dose has been reached. Keep note of this, journal everything. Our brochures, I don't know if you all can see me, but all of our brochures actually come with a journal on the back page. So it asks
And Cassidy, part of the follow-up to this is they're going to get a link to a thing called a patient information brochure.
Perfect.
And in that patient information brochure is all the information you need to do your journaling. And that's one of the links that you'll get as a follow-up to this webinar.
And it's really, really important to do this. I mean, you're being held accountable for the relief that you're finding in your medication. So it's case by case. It's encouraged to journal. Write down the time that you took your dose. Write down the strain. Look up the lab reports. Write the most common terpenes in that strain. Write if you took it on an empty stomach, the effects that you felt. Revisit that journal in an hour or two, and then write out your effects. So you can really see how the medication is working for you. And if it doesn't work, it doesn't work. You probably will find something that's going to work for you. Just return the product and swap it out for something different. Sure.
And I think what I learned about journaling, and I know I'm a guy, so like journaling was like, I don't really need to do that. But because I had herniated discs in my neck. And then what happened was I had a knee replacement or left knee replacement, which is a real pain event. I started doing some journaling, and I started noticing it was more effective when I was eating than when I didn't eat for cannabis, for example. I started noticing some things like when I took a high regimen of CBD, my pain went down. Now I was into this, if I got pain, jumped to the THC side, and all of a sudden it dawned on me that I was getting pain from inflammation. So I wasn't solving the problem. I was going after the symptom, but not the problem. But once I understood that, then I was able to increase my CBD. In fact, I take probably a higher CBD ratio than normally people would think with people like with herniated discs like I have, which is very, very interesting. So.
Sure, CBD is great. I encourage patients to take it like a multivitamin, take it every single day. You're not getting any negative effects from CBD. A lot of times we recommend, again, start off low, go slow, but 10 milligrams is a pretty good starting dose for edibles and capsules and other oral products. So just take note of all of that.
And we'll jump into it next week if you need more information.
Exactly.
So, one of the questions that Linda was just asking, I just noticed that, is Trulieve located in Massachusetts?
We're in Northampton, Massachusetts. I'm super excited to say that we opened up a couple months ago. So yep, we're up there.
Right. So one of the questions that people ask these are some of the common concerns about medical cannabis. We're kind of wrapping up this portion of the presentation. I don't want to get high. Okay, I'm worried about the euphoric effect. Will it conflict with other medications? Can I drive using medical cannabis? Is it hard to get around? Can I get it delivered? A lot of those questions, the answer is you have a great delivery thing. We'll talk about that when we talk about the Trulieve slides. The answer is, especially as a senior citizen, get delivery for free. And can I drive? It goes to your regular medications. When you take a regular pharma drug, it'll tell you, be careful of what's there. You'll know if you're getting high or not. I don't recommend getting high. You'll know when you know what your routine is, what your regime is, it's there. The answer is I drive. I take medical cannabis, and I don't really have a problem driving. Cannabis is a little bit different from alcohol. A lot of people drive alcohol, they want to take their car and drive as fast as they can. A lot of people who take medical cannabis want to relax and sit back. So it's a little bit of a different experience. But the point is, you shouldn't really have a problem driving. Once you know your sweet spot, and that's the key. As far as conflicting with other medications, you want to take that one, Cassidy?
Yeah, sure. So there are no negative side effects or negative interactions when it comes to, like other medications that you may be taking. But if you want to be sure, there actually is a website. I can find it and drop it in the chat if you're interested. But I believe maybe it's something like WebMD. You can type in 2 medications. You have to type in at least 2, and then it'll populate reports on if there have been any deaths and the potential negative side effects.
Yeah, the only side effect that we really worry about is with heart medications, heart blood pressure and blood thinners. Because it is distributed through your bloodstream, you have to be very careful if you're on blood thinners or something like that. So just pay attention to that. By the way, you still can use medical cannabis. We recommend you have your medical cannabis doctor and your medical doctor work together. It's a matter of just getting the dosing right. It's a matter of just adjusting the formula to get that right. That's out there. And one of the questions that people ask for long-term health is, can I get addicted? Cassidy, can I get addicted?
The short answer to that is no. What we're actually seeing is cannabis is more of an exit drug when it comes to other medications, opioids, for example. It's not a gateway drug to, in the past, we may have heard that cannabis is a gateway drug and it leads to other substances and it's addictive. And the answer is no. We've actually seen patients come off of opioids and taper off of other harsher medications, narcotics, Xanax, and just use cannabis, which is a lot safer. The negative side effects are, dry eyes and maybe munchies, maybe you'll fall asleep, something of that nature. But yeah, to answer
I think that, look, I take cannabis for pain relief, to be blunt. I have 7 herniated discs in my neck. About every 6 to 8 weeks, I will take what they call a holiday. I'll take a day or day and a half, maybe 2 if I can, to let my body recharge. In other words, my body can get lazy. Since we're putting cannabis into it, my body can get lazy and not do that. It helps my body basically recharge. Now, I'm not addicted to cannabis. After about a day or a day and a half, my neck taps my shoulder and says, better do something quickly because I'm bringing the pain back. So I'm not addicted to cannabis. I'm addicted to pain relief. There's a difference, okay? And I have no negative side effects. I have no withdrawals. I'm not hung up with anything. I'm not going to die. I'm not going to overdose from it. But it does whatever effect that you're trying to address, it does go away. So it's something that you may want to take a look at. It's out there. And I think the question of, do I have to smoke it? The answer is no. The two big legal impact questions are, if I get stopped by the police with a medical marijuana product, will I be arrested?
So the answer to that is, if you have your medical marijuana license, which it is a
Card, your card with you.
Your medical marijuana card, excuse me, you are at liberty to have that medication on you, and you really shouldn't have it. You shouldn't have the vape pen attached to the battery and your edibles open. That shouldn't be happening. But all of the products do come with kind of like prescription labels. They'll print off just as you were to pick up, your prescription from the doctor. It says the doctor's name, your name, the date that you got it. All of that information will come on a label that you're going to get when you pick up the product. And as long as you have that with you, you are good to go. It's legally your medication, and you cannot be arrested for having those products with you.
It's very much like alcohol. Look, alcohol has an open container policy. Don't rock around with a can of beer in your hand and don't drive. They're going to be in trouble. Same thing, don't be smoking a vape pen while you're driving, or of course, it's hard to be tell if you're eating edible, that's for sure. But on the other side of the coin, if you have it with you and you have your medical cannabis card, like your driver's license card, you're legally allowed to possess it, just like alcohol. You can have a bottle of alcohol in the back seat, just don't have open container. That's all. And
exactly.
It's really there.
And that kind of ties into Mary's question in the chat. She asked, can I travel out of state with my medical marijuana? Well, the answer is it's legal in the state of Florida, so you are able to travel around. In our bordering neighbor state, actually Georgia, it has been decriminalized, legalized, so they don't have any medical marijuana treatment centers there now, but assuming that they will soon, because they do have physicians recommending, there's just nowhere for the patients to pick up medication. I guess the short answer to this is no, you shouldn't travel out of state with your medical marijuana license. But if you find yourself in Georgia and it's a legal state, I think that may be the loophole there. But the short answer is no, you should not be traveling out of state with your medical marijuana license.
Look, stay safe. I mean, look, I don't want to get the ambiance of a Alabama state trooper. That's for damn sure. Okay.
Exactly.
And even if it was legal in Alabama, I'm not throwing rocks at Alabama. I'm not quite sure they know what to do with it because it takes a while for them to implement things. My point is that when I went to California, what I do is I call my family and I stop it from literally when I stop from the airport to my mom's house. I stopped at the dispenser and I picked up the products that I needed and went from there. That's the best way of doing it. If you're traveling out of state, I don't recommend it. People do. Just be careful. Again, it's a state by state regimentation. Certain states are open to it. By the way, most people are open to it. Like in the state of Mississippi, where a lot of the gambling casinos are, 74% of the people voted for medical marijuana, and then the state Supreme Court decided to turn that around, which is going against the will of the people. I'm not going to make comments about the politics there. It's just obviously the legal system in Mississippi doesn't want to welcome medical cannabis right now. So be careful. That's all. I wouldn't tempt fate. Let's put it that way. Okay.
Yeah. So to recap, it is your Florida medical marijuana card. So you're able to pick up the medication in Florida. You can shop in Florida. You can travel around with your medication in Florida as long as you have that prescription label it prints similarly to a prescription label. As long as you have that label on the product and as long as you have your medical marijuana card with it. So to answer anonymous attendees' question in the chat, can you carry on a plane? Depends on where you're going. Honestly, if you're traveling in the state of Florida, if you're going from, Tallahassee to Miami, as long as you have your medical marijuana card and you have all of those labels packed away.
Be a little bit careful. Let me tell you what I'm being careful about. The TSA is not looking for cannabis. They've actually come out and said, we are not looking for cannabis. We're not testing it. We got no dogs running around sniffing it or anything like that. However, once you pass that detector, you are in federal space. You're not in Florida anymore. You're in the United States, but you're in federal space. If you have a vape pen, if you have cannabis products that you drop it in a little tray and the person who's the TSA agent sees it, he has to do something about it. He doesn't want to. Trust me, they have better things to do. They're screening for guns and bad guys. They're not screening for cannabis. Don't tempt fate. Don't carry it on a plane. Drop it put it in your luggage if you're going to do that. Because again, if you have cannabis products, they have no dogs sniffing for this stuff. All right. There's people that have told me that they do. I've talked to a number of TSA agents. I have a good friend of mine who's a supervisor of a TSA program in Southern California. They have better things to do. They've got bigger fish to fry, but don't tempt fate. Let's put it that way. That's out there. Last question here is, will I lose my gun? The answer is no. You're not. Nikki Fried, who runs the medical cannabis program here in Florida, also supervises the concealed weapons program, and they will not take your guns away. That's a myth. Now, here's what will happen. If you go to buy another gun, you have to fill out a federal, not a Florida form, a federal form that says, do you take medical cannabis? And if you answer that question, yes, they will probably not give you that gun. Okay, so that's the negative of that. It's there. So hopefully I answered a lot of those questions. We're going to jump into Trulieve real quick. Let you answer a few of those questions, Cassidy. I put this picture up because a lot of people, you can see by what's behind me, a lot of people think of cannabis dispensaries as kind of head shops. You guys are more like Apple stores.
Exactly. We are very, very clean, very medicinal. We've actually been compared to physicians' offices and doctors' offices. You first enter and you wait in the lobby. You provide your medical marijuana card to the consultant at the front desk. And, you wait around. You have to wait your turn as you would in a doctor's office. Typically the wait, it varies depending on if it's a sale day, what's going on in the store. But you will have to wait for your name to be called, and then you'll enter the dispensary and you're able to shop. So
now you have a very cool system you've implemented. You can actually go online, tell them you're coming, put your name on the wait list. So when you walk through the door, you're pretty much queued up, ready to go. Is that right?
Exactly. So we have a couple of different options. We have pickups and delivery options available. So if you want to schedule a pickup order, you're actually kind of prioritized ahead of the regular walk-in patients just because your order is already there. It's ready for you. And Marc is correct. If you place an order online or you do the order through the call center, it'll actually text you a link when your order is ready. Give us about 2 hours to get that order ready, and then we'll text you when it's your turn to come pick it up. And if you pay attention to the very bottom of that text message that it sends you, there actually is a link for you. It's called a Waitly check-in. There's a link for you to check in, and it'll text you. We actually implemented this because of COVID. Actually, maybe a little COVID, but it saves you from, being exposed to all of the other people in the dispensary lobby. You can actually wait down in your car, and we'll text you when it's your turn to come straight back to the dispensary and pick up your medicine.
So let's talk about your nanotechnology. I think this is very cool. And by the way, this gets into some of your ratioed products, which we'll talk about in just a minute. But nanotechnology is really nanomedicines that are here. Tell us a little bit about that, the sonification piece.
Sure. So nano essentially just means really, really small. So our nano products available currently, we have tinctures, so those drops, the liquid drops. We also have true nano gels. Those are our gummy edibles. So with the nanotechnology, we use a proprietary process called sonication. So essentially, we're breaking down the THC and the CBD and all of the cannabinoid particles, and we're making them very, very small. So you're able to absorb more of it through your bloodstream. It feels a lot stronger, and it feels the effects come on a lot sooner too because of the very small particles. So essentially, when you're eating just a regular edible, you're eating a gummy, a brownie, whatever it may be, and it's not a nano product, the bioavailability is about 30 or 40%. So that means your body is really only taking on about 30 or 40% of the effectiveness of that medication. So the benefit to these nano products, right, are nano tinctures, which come in 8-to-1 ratios and 1-to-8. Respectively, the CBD comes first in the 8-to-1, and then in the 1-to-8, the THC comes first. So these are great entry-level products, but the bioavailability of those goes from regularly 30 to 40% to about 90. So these are very cost-effective medications. You're going to feel the effects a little bit sooner. So regularly, you may feel a tincture in about 20 minutes. If you take the nano tincture,
and you need to take less of them.
Exactly.
We get the same effect. Okay. So a lot of people who've tried CBD from, let's say, a local CBD store now come in and try one of these things, and they find that your products are, I'll use the word, more potent. And the potency comes from the fact that it's not necessarily that there's more product in there as far as THC or CBD. It's just that with the sonification, it gets into your body, and it becomes absorbed a lot quicker, and it works a lot quicker. And I noticed that you have you have the ratios that are here, and it's a great price for those that are down here.
Exactly. And essentially, you just may need less of these nano products. So if you regularly eat one 10 milligram True Gel gummy, you may you probably should just start off with half of that dose,
Right.
See how you feel it out. But it should feel a little bit stronger than that regular 10 milligram non-nano gummy.
Right. And here are those ratio products that you talked about, especially like Delta 8, the vape cartridges and things like that.
Exactly. So these are all wonderful entry-level products. So the True Clear here, the True Clear is actually that image in the center. It kind of looks like a syringe.
Right
It
here.
is a syringe, but there are no needles. Don't worry. This is a very versatile product. This is, it's already activated THC, so you can actually make your own edible out of this. You can vape this. You can use this topically wherever, your pain is. Just mix it with a little bit of lotion. But we offer this in 1-to-1 CBD THC options and 1-to-1 Delta 8, Delta 9 options. So that's full THC there if you're looking for, a little bit less psychoactivity, but pain relief. Both of these 1-to-1 options are going to they'll probably be great products for you.
By the way, one of my favorites, by the way, of products that you have is this one. You call it Laughing Buddha.
Yes.
It's 1-to-1-to-1. One Delta 8, one Delta 9. By the way, when I had my knee operation, which is about a little over 2 years ago, I was turned on. One of your representatives taught me about this. I use that pen follows me. If no matter where you are, if you frisk me, I have my car keys and I have my pen with me. I mean, those are the things that are always there. That Laughing Buddha one used to just call it 1:1:1. Now you give it a good name. It's out there. That and Pink Lemonade, which is, again, CBD and Delta 8, which is great.
And these true pods, they're square shaped pods.
Right here.
You also have to have the square shaped device. There it is down there. It's called a true pod, and the device is called a true stick. And we actually offer them with haptic dose systems. So you press the button and you take an inhalation of your medication, and then it'll vibrate when you've gotten a 2.5 milligram dose. So these are really, really cool if you're worried about, you know, how much medication am I taking, or what's the dose that I just got. After you feel that second vibration on that vape cart, it's safe to say that you've gotten a 2.5 milligram dose. So these are wonderful products.
And this helps answer the question, the last question we have out there is somebody who's tried vaping, but they take a little bit, but they sometimes they get coughing. I think the coughing comes from sometimes some people will use cutting agents, not Trulieve, but some people will use cutting agents that bother your lungs. And a quality vape pen shouldn't give you a cough. But also, if you take too long of a hit, that will cause that problem, because your body's not used to that. Just like cigarettes, if you take too long of a hit, it'll be there. It doesn't have the carcinogens that cigarettes has, but it definitely will irritate your lungs. One of the things about the True Stick is it beeps, keeping you from having that particular problem, which I think is great.
Exactly. So
and then you got lots of little gels down here, which I love. I love the CBD, CBNs. This one right here is really a killer right here.
Yeah, all sorts of ratio gummies. We have the 1:1 CBD THC. We have it 5:1. So this one's mostly THC with CBN in it as well. This is an awesome product for falling asleep. Again, remember that CBN is a potentiator for THC. So this may feel similar to a nano gummy, for instance, because it might feel a little bit stronger because of that CBN. But we also have a 1:1 CBD CBN. So this could be like your inflammation, you know, holy grail. This could be awesome for you. And we also have the 1:1 CBD THC.
And if you're a person that you've tried the 1:1 ratios, and it's something you have the THC tolerance that you can be able to handle that. I know a number of people use the CBD gummies, this one right here, this 1:1, and they'll take the gummy because it gives them lasting relief all day long while they're working. It'll last all day long to give them that pain relief that they're looking for, as opposed to having it work for 2 or 3 hours and then you got to do that again. It's out there, so or something you may want to take a look at. Let's hear.
Yep, and then we also have, if you're interested in an oral product, we have the capsules. So if smoking makes you cough, maybe try something oral. Maybe try a tincture, an edible, a capsule. But we do have the 1:1 capsules available as well.
Right. So tell me about your discounts. Everybody loves discounts, man. That's the way to go.
And we have the best discounts in the state of Florida. So if you go to welcometotrulieve.com, it's actually going to give you the rundown on all of the new patient essentials, but I'll go ahead and just tell you right now since I have you. So your very first discount at Trulieve is going to be 50% off. Your second discount, yes, 50. Your second discount is going to be 15% off. And once a year when you renew your medical card, so we had briefly talked about this, you have to see your physician every 7 months. But your medical marijuana card expires every 365 days. And you're going to have to pay the state $75 to approve your card or deny your card, but hopefully it's approved, $75 once a year. So we'll give that back to you as a reimbursement. We also have a loyalty program. So every dollar that you spend, you're getting a point, and your points accumulate into 10% off discounts. We offer discounts to veterans and SNAP card holders every single time you come in and shop with us. So that means if you're a veteran, you're going to get 20% off of our products. If you're a SNAP card holder, or you get food assistance, you're going to get 10% off every single product. So if you're a veteran and a SNAP card holder, you're going to get 30% off every single visit. So the person here who was asking about the RSO, yes, we offer an RSO discount. The RSO syringe is $50 in our stores currently. But if you buy 10, you actually get $200 off of that. So the bulk RSO discount is great. Take advantage of that. We also offer discounts for birthdays and seniors. So most of our patients are around the age of 60. Sunday is your day. Every single Sunday, we offer an additional 10% off.
And a lot of these are stackable too.
Exactly. So if you have, 10% off and discounts with the loyalty program, and you shop in and you come and shop with us on a Sunday and you're a senior, that's 20% off that you get. And this special discount that we're offering during the month of October, we actually ran this promotion last month in September, and we saw, awesome results with it. So we're extending it through the end of October. It's our refer a friend promotion. So if you as a patient brings in a patient for their very first time shopping with us, you both get 50% off, 50. So this is an awesome discount. Please take advantage of it. It's going on until the end of the month, and we're only on the 6th day.
Right, you got it there. So deliveries and pickup. By the way, Lee asked a question, does Trulieve ship within the state of Florida or California?
So we do deliver here in the state of Florida. We deliver usually within 24 to 48 hours. But if you're in a 10-mile radius of a delivery location, and if you want to just type in the chat where you are, I'll tell you your closest delivery location. But if you're in a 10-mile radius of a delivery location and you place the order before 10 a.m., you actually get the order the same day. We're offering same-day delivery, so that's really cool.
If you're 65 or over, it's free.
It's free. We'll waive the delivery for you if you're over the age of 65.
But even if not, the delivery fee is what, $15 or some crazy number like that?
It's $15, and if you're planning to spend over $200, which happens, honestly, there's so many products out there that you're going to want to, you'll probably spend around $200. It's going to be free. Or if you're, spending 50, 60, 80, whatever amount, and you're under the age of 65, it is just going to be $15. And we'll get it to you wherever you are. Even if we don't have a dispensary location near you, which we have over 90 in the state of Florida, we probably do have one around, but we'll deliver it to wherever you are.
There you go. And now what I like about your pickup orders, if I do order it and I go to pick it up, is once the order is complete, you get this text message, but your express check-in is really cool, because what I'll do is I'll once it's ready, I'll tell them that I'm coming. And by the time I get from my house I live in Claremont, to the dispensary, I just literally walk in and pick it up, which I think is great.
Yeah, this is a great option. It's the end of the day. Maybe you go online and order while you're at work. Say it's 10 a.m. and you're working all day, but you need to pick up your products because it's Friday. Go online, place that order, give the call center a call. They'll make it very, very easy for you. Just, provide them your patient number and your date of birth or your first and last name, and we'll create a pickup order for you. We'll hold it for 24 hours. You have 24 hours to come pick it up, but it's 5 p.m. You get off, it's busy, traffic's busy. You check in on your phone, let them know, hey, I'm leaving work, whatever. It's just a quick button, check in on the way. They'll text you when it's your turn to come inside. So by the time you get there, you don't have to wait in the lobby. That can be such a hassle, especially if you've just gotten off work and you've worked all day. Check in online and they'll text you when it's your turn to come in, and you're prioritized.
Super. So Cassidy, we kind of covered Trulieve, we kind of covered arthritis, we covered the strains, we covered a lot of information. I know a lot of people say these webinars are like drinking water out of a fire hose. You get a lot of information. And again, I'll mention to everybody that thank you very much for sticking around for, it's been almost 2 hours. You will get an email with the video, get email with the presentation, the discounts, the notes, everything. You'll be getting that as a follow-up to this. And so please feel free to that. Again, my goal is if I can help just one person get their life back, if one person can watch this webinar and actually get pretty close to getting their life back, that we've been successful. Cassidy, you got some things you want to wrap up with?
Sure. Yeah, I'm going to throw my email in the chat. If anyone wants to connect with me, I'm based here in Delray Beach, but my zone is I'm all over the place. I work from Boca to Fort Pierce to Okeechobee. So if anyone has any questions, follow-up questions after this, I appreciate your time. It's been an almost 2-hour webinar, so that's really exciting. I appreciate all of the questions, and I love talking about cannabis, honestly. So I'm going to drop my email in the chat, and if there's anything that if there are any more questions, feel free to ask right now.
Cassidy, okay, we'll include it in follow-up notes as well, if that's okay. And then I think Tina asked the delivery area for Reynolds Road, Lakeland. you have a dispensary in Lakeland, right?
We do, yeah. I'm unsure if it's a delivery location right off the top of my head, but I did just send my colleague over in the Lakeland area a text message. So if it doesn't come by the end of this webinar, just shoot me an email, Tina, and we'll see what we can do about getting you some discounts too.
Good. Okay. Well, Cassidy, thank you very much for your time. We really appreciate it. And I much appreciate Trulieve for doing the sponsorship for this particular webinar. More importantly, I'd like to thank not only yourself and Trulieve, but for the people that are watching. We really thank you for your participation. I know it's been almost 2 hours and there's been a lot of information. Thank you very much. We really appreciate it. And next week, we're talking about dosing. Please feel free to tune in to marijuanaaware.com, and please feel free to register. I know that's an important topic when it's out there. And again, we look forward to your feedback. Cassidy, thank you. For those watching, thank you. More importantly, Lee and Deja for your moderators. You're making that happen. I know it's always a lot of work, but you really make this thing happen. So thank you very much for your time. I hope everybody has a great weekend, and please, everybody, stay safe. Thank you.
Thanks, everyone.